Hello, hi. Welcome to today's topic, which is the types of orthodontic forces. Based on the duration of application of orthodontic forces and the rate of decay, orthodontic forces can be divided into three. They are continuous forces, interrupted forces, and intermittent forces. The first one is continuous force. It's an active orthodontic force that decreases by a little magnitude in between patient appointments. Or as you can see, the force is never declined to a zero in between patient appointments. And also an appreciable magnitude of the appreciable fraction of the original force applied is always maintained in between patient visits. Or in other words, as you can see, a little fraction of the original or a little fraction of the force applied is being decayed in between patient appointments. And ideally, light continuous force is the most effective force that can be applied for affecting tooth movement, as it is expected to bring about direct frontal resorption of the tooth socket. And for an appliance to distribute this type of continuous force, the appliance components should be flexible for small deflections, and the activation should be given to a very small amount of force, and this force does not occlude the blood vessels in period, and so the nutrition supply is not compromised or not affected. Thus the time lag required for the tissue healing is very less. The next is interrupted forces, in which the force declines to zero in between activations. It's an orthodontic or orthopedic force in which the force is inactive for a time interval in between the appointments. And for an appliance to deliver this type of interrupted force, the appliance components should have a high stiffness, and the initial activation should be high. That's this initial activation produces exerts a high level of force. That's the initial force exerted is high, which produces the required tooth movement due to undermining resorption. And when the desired tooth movement is achieved, the force gradually decreases or declines to zero, and which gives enough time for the tissues to regain the blood supply and enough time for the tissues to recover before the force system is again reactivated. Both continuous and interrupted forces can be achieved by fixed appliances that's constant for a time. And for the examples of appliance that produces these interrupted forces includes retraction using loop mechanics. Third and finally is intermittent forces. The intermittent forces are produced by all patient activated appliances like removable plates incorporating springs, labial bows, screws and elastics. And the intermittent force levels are abruptly declined to zero when the patient removes the removable orthodontic appliance, or the clinician temporarily deactivates the appliance and then returns to the original level after some time. And the prerequisites for an intermittent force to be delivered is that the first one, it should deliver a heavy force, and there should not be any force decay, and there should be a specific magnitude time pattern, for example like 300 to 400 grams of force for a period of 10 to 14 hours, and the inactive period of a day should be sufficient for the periodontal ligament to remain healthy when the total time duration of the period usage is considered. Thank you.